So this is a special card. Some of you have seen something similar some time ago. And I think there are many ways of starting this card. You know, you can also start it as if you were coming to the patient's home. But I would choose in this case to be in the house. So you are making a home visit to a patient who is suffering from chronic obstructive pulmonary disease and requires continuous oxygen. Mobility is now a problem. The patient's spouse has been caring for him at home for 2 years, but has recently returned to work. You have just completed an assessment of the needs and are discussing present continuous, now at the moment of speaking, full-time care options with his carer. So it seems that in this case, we are already in the house, although it is a home visit. And if you started the card in any other way, I'm so sorry. And you are already in the house. Now, when you are in the house, there are some things we should do and we should not do. First of all, if you're already in the house, it means you have already checked the patient's name or the carer's name, and you have introduced yourself. So it would be quite strange to do it again. However, what you should do would be to use the names and start directly with the context. And this is something you can use every time. Now, Mrs. Smith, that I've finished, completed. Yeah, I've just finished, just completed your husband's assessment. Because again, if you look at the tasks, that's why I said this here. If you look at the tasks, you're not talking to the patient. You are talking, and also read very carefully the context. You're talking to the carer. You're talking to the spouse. It's time for us to, or I'd like to. Now, some time ago, there was a card. Let me just try and I have to take everything that's on the screen away, okay? But you do have it in the recording. Let me just try and find that card, because there's a similar card with a home visit, but I think I have it in the teacher's resources given by OET. Just a tiny little second. Test. Speaking, nursing. So a similar card is this one, home visit. You are visiting Clara, a 6-year-old child, to perform preliminary health checks. Yeah, we read the card. To perform preliminary health checks to assess the child's development. So you are there to do the checks, and you already have the results. Their hearing, vision, height, and weight are normal. And now you want to provide the child with vaccinations. So you wouldn't play this card as if you were at the door, because you are not at the door. You came to do the checks and you have done the checks. So now you're at the second stage. So in this case, you would start in the exact same way. Now, name of the patient name of the person you're talking to. Okay, that name of the patient, well, patient's name. Now that Clara's preliminary health checks have shown that the values are within the normal range, I've just tried to change a bit. I would like to, so this is the exact same thing that we had in our card earlier, okay? So read the context, try to understand the context, This doesn't only happen when it is a home visit, okay? It can happen in many other contexts. You could be in the middle of the conversation, so you don't introduce yourself because it's obvious, but you do need to use the patient's and the carer's names. Any questions at this point if you have?